Coming to the OHS, why we are going to learn about these oral anti-diabetic drugs or oral hypoglycemic drugs? Because most of the patients in the pre-operative period are taking these oral hypoglycemic drugs, and in the exams, in the viva, they will going on ask which of the drugs should be continue in the perioperative period, which of the drugs should be stopped, and what are the complications of these drugs. Second thing, some of the examiners or some of the externals or internals, they are going to asking about the mechanism of action of this drug, mechanism of action of that drug. So therefore, overall oral hypoglycemic drug is important for viva. Coming to the three classifications, they enhance the insulin secretions, they overcome the insulin resistance, and miscellaneous group of drugs. Coming to the drugs which will enhance the insulin secretions, they are mostly potassium channel blockers and DPP-4 inhibitors. In the potassium channel blockers, sulfonylurea, tolbutamide, glibenclamide, gliclazide, and glimepiride. These are the group of drugs. Blagnitide or phenylalanine analogs like rapaglinide and netagliptide also the group of drugs. Coming to the DPP-4 inhibitors, sitagliptins, vildagliptins, saxagliptins, allogliptins, and elagliptins. Most of the patients nowadays, they are mostly taking DPP-4 inhibitors. Fine, the DPP-4 inhibitors are very much important. Overcome insulin resistance like bigonids, mostly AMPA kinase activators, there is metformin, and PPAR gamma activators known as pioglutazones. Fine, in the miscellaneous group of drugs, alpha glucosidase inhibitors, acarbose, miglitose, and moglivoge. Amylin analog, again pramaglinide. Dopamine receptor D2 receptor agonist, bromocriptine, and also SGLT2 inhibitors like dapagliflozin. So these are the group of drugs which are mostly important, and nowadays the mostly patients are taking these DPP-4 and SGLT2 inhibitors. So we face most of the patients are mostly taking also metformin and alpha glucosidase inhibitors, or this rare group of drugs they are taking mostly when they are combination with 3-4 drugs like that. But in the maximum scenario, we'll see that the patients mostly taking DPP-4 inhibitors, mostly bigonids and SGLT2 inhibitors. Coming to the mechanism of action, in this case, say potassium channel inhibitors, whatever then when there is increase in glucose, there is increase in ATP, and once this ATP will be stimulated, they inhibit the potassium channels, they cause depolarizations, so therefore there is a calcium influx and insulin release. So the sulfonylureas and meglitides, they directly inhibit these potassium channels and they cause depolarization, they increase the calcium influx and helps in the insulin release. Therefore, they helps in the insulin release. So this is the mechanism of action of sulfonylureas. Mechanism of action of sulfonylureas. See, this is the potassium channel inhibitor group of drugs or potassium channel blockers group of drugs. Sulfonylurea, mostly glibenclamide, gliclazide, this glimepiride, this group of drugs, they release the insulin secretions. So here you can see, because as glucose enter, glucose will form glucose 6-phosphate. On the metabolism, they form ATP, and this ATP which inhibits the potassium channel, and finally due to the inhibition of the potassium channel, the calcium influx will be there, and once the calcium influx will be there, they release the insulin. But this group of drugs directly inhibit the potassium channel, ATP sensitive potassium channel, and they cause calcium influx and finally insulin release. So they helps in insulin secretions or insulin release.